news. A 92-year-old patient had told the BBC that she had received the wrong medication due to mistakes made by the GP. And later joining me in the studio today are Fivos, Professor in Organisational Behaviour, and Steph, the NHS representative. First, let's hear from Chengbo, who is currently at the scene with the doctor and nurse from Imperial Hospital.
Thank you, Junior. And I'm here today joined by Dr. Jing and the nurse Johnny, who was criticised for the medical failure. Would it be possible for you to explain how you treated this failure and what reactions did you take?
Sure. We have to apologize for our mistakes, and I have to admit that I did play a role in the poor outcomes because I was too busy and stressful to check the records between the patient and the prescription of drugs. So after the failure, I was so depressed at first, and I tried to figure out how these errors happened. And based on self-reflection and feedbacks from colleagues, also I have to analyze the failure to figure out how to prevent it with better culture, better communication, and procedure redesigns.
Okay, let's hear from the nurse now.
I was so ashamed to hear this from our patients, and I was the only one at fault because I handed the medications to the families of these patients without checking. This failure actually set me back and made me blame myself for my carelessness.
Thank you, Chengbo. This is clearly a major issue. We have invited two experts on managing failure today to discuss this further. Steph, it has been found out that medication errors account for 1/5 of mistakes related to hospital care, including errors in anesthesia administration before surgeries. How is it possible that this happens so often?
Organisational level, this is a massive issue in healthcare due to overstretched nursing staff and intense pressure on doctors. Within teams, there is poor communication, and together with varying skills levels, fatigue and poor documentation of procedures, it is easy to see how these failures can occur. Nonetheless, they are preventable. Moreover, it's very important to emphasise that it's not about blaming doctors, nurses and pharmacists who work incredibly hard with huge amounts of pressure. Instead, it's about having a positive culture where we have the checks in place to stop this from happening. Doctors shouldn't be worried about being criminalised or losing their jobs. They should feel confident in being transparent and embracing failures. In this way, we can effectively detect and analyse failures to learn from them.
Thank you, Steph. And Fivos, given your expertise, how would you suggest managing this failure in order to prevent future occurrences?
There are many types of failure, including long-lasting problems, well known but not addressed, lack of management systems, and repeated incidents. This specific failure covers most of these types. Often in healthcare environments, many failures are not reported due to fear of blame and defamation among colleagues. This is counterproductive, and we have to encourage tolerance in order to extract knowledge and learn from failures. From individual level, it is crucial to learn from failure with positive attitude and activities to effectively detect and analyze failures. In order to effectively detect and analyze failures, this requires cultural and structural change in healthcare environments and organizations. Process should be checked by a series of people, and systems should be monitored continually and analyzed until it is optimal and errors are minimal.